Welcome back to Empowered. I'm Elizabeth Namofsky. On today's episode, we're discussing empowering women to take control of their health. So I want to talk about the winter months. Everybody's afraid of getting the flu, catching a cold, or even COVID again. What can we do so that, we know that we've protected ourselves from any of these sources?
So this is where the fundamentals are important, Liz, like sleeping well, lots of exercise because it actually boosts your immune system. Right? A great diet made out of a lot of colorful vegetables. Your mother was right. Do eat your vegetables. The more colorful, the better, with, red peppers and broccoli and berries and oranges. These are going to be really good for you. And then also still protecting yourself in large crowds, maybe considering a mask if you're going to be in the subway or very crowded spaces.
So let's talk about type 2 diabetes, because I see ads all over the place on TV. Every other ad has to do with diabetes. So are the rates on the rise worldwide, and is this inevitable?
Well, first of all, you're right. The rates are exponential right now. So this is really a true epidemic, what we are witnessing. Now, it does not have to be inevitable. Actually, the Harvard School of Public Health last year declared that 90% of all cases of type 2 diabetes were preventable. This means that type 2 diabetes is truly a lifestyle disease. So that means that with, a lot of personal interventions and obviously support from our doctors, we can definitely prevent this from getting worse.
Okay, so let's take it to the next level then. What can women do to prevent this? I know you said it's a lifestyle.
Yes, lots of things, Liz. But the first thing is diet, right? It is an insulin disease. So it has to do with definitely our nutrition. The other thing is more movement, right? It's been difficult. It's been challenging. We've had some very tough years of a lot of stress eating and a lot of confinement. A lot of us have also not even gone back to our healthy habits of pre-COVID. So these are very essential things for us to do. And for women in midlife, which is a consequence of menopause, we are even more sensitive to insulin. So it becomes even more important to be proactive about movement and our diet, essentially.
So speaking of movement, you and I discuss things all the time, whether it's working out or food or vitamins, supplement. You and I are constantly talking about different things. And we both agree, you need to work out. I need to work out to clear my brain, relieve my stress and everything else. And you do it for the same reason. We all know that being active is critical to good health. That's known. But, a lot of people just do cardio. A lot of people just do weights. What are the forms of exercise that we should be doing? Because they are not all created equal. Like, what should women do, especially at midlife, to really support ourselves?
This is when we really need to start actually dialing down the cardio, say goodbye to Jane Fonda and, still have a little bit of cardio, yes, but we need to really dial that down and adopt a different type of cardio where it becomes a little bit shorter, but more intense. It really is called SIT, which stands for short, intense training, where we are focusing on 10 to 30 seconds of very intense effort with some breaks, and basically put that on a rinse and repeat. This actually allows for greater lean mass and burning some of the fat, which, a lot of women in midlife are looking to do. But there's also another type of exercise that is really good for us at midlife, which is basically strength training. So embracing the weights. Right? And now what we're talking about here is not becoming necessarily a gym rat and spending hours and hours, but rather really increasing the weight and doing shorter amount of reps. This is where we're basically having the highest return on investment in terms of our health. Now, I always recommend before you go and plunge into this weights to get, the help of a personal trainer to make sure that you've got the right technique, obviously.
Perfect. Don't go away. We'll be right back.